Assalamualaikum. Previously, we studied movements in the upper limb. Now we are proceeding to the second part of the chapter, which is movement to the lower limbs and onward. Now, movements in the lower limb, we have flexion of thigh, extension of thigh, abduction of thigh, adduction of thigh, medial and lateral rotation, flexion of knee, extension of knee, dorsiflexion of foot, plantar flexion of foot, inversion of foot, and eversion of foot. Now, what is flexion? Flexion is when front of the thigh comes in contact with front of the abdomen. This is flexion. Then extension. When person stands erect, this is extension. Then abduction. When thigh is taken away from the median plane. This is abduction. In adduction, when thigh is brought or close to the median plane. This is adduction. Medial rotation, when thigh is turned medially, and lateral rotation, when thigh is turned laterally. This is medial rotation, and this is lateral rotation. Then flexion of knee, when back of thigh and back of leg come in opposition. This is flexion of knee. This one, the dotted section. Then extension of knee when thigh and leg are in straight line as in standing. This is extended knee. Dorsiflexion when dorsum of foot is close to front of leg and sole faces forward. This is dorsiflexion. This is dorsum of foot when it is brought closer to the leg, and this is sole of foot when it faces forward. Plantar flexion of foot when plantar aspect of foot faces backward. This is plantar flexion as a person is standing on his toes. Then inversion of foot. Inversion when medial border of foot is raised from the ground. This is medial of border of foot along the big toe. When it is raised, this is inversion. Remember, inside border is raised. And eversion when lateral border of foot is raised from the ground. This is eversion. Along the little toe when lateral border is raised. Then we have movements in the neck. Flexion when faces come closer to the chest. Extension when when face is brought away from the chest. Lateral flexion when ear is brought close to the shoulder. Rotation when neck rotates so the chin goes to the opposite side. Opening the mouth when lower jaw is lowered to open the mouth. Closing the mouth when lower jaw is opposed to the jaw, upper jaw. Protraction when lower jaw slides forward in the socket in the temporal bone. Retraction when lower jaw slides backward in the socket in the temporal bone. Then we have some movements in the trunk. That is extension, bending backward, flexion, bending forward, lateral flexion, sideways movement toward the side, and lateral rotation when sideward rotation. It is the sideward rotation. Now we will just go and see the diagrams. This is protraction when chin is brought forward. This is retraction when chin is brought backward. Then we have movements in the neck. This is flexion of neck. This is extension of neck. This is sidewise flexion. This is rotation. And then we have studied the opening and closing of mouth. When taking the food and when we are not talking, we can say. Then we have movements in the trunk, and this is extension of neck, this is flexion of neck, this is lateral flexion. We have some terms used for muscles. Origin, the end of muscle which is relatively fixed during contraction. Insertion, the end of a muscle which moves during contraction. Belly, the fleshy part and contractile part of muscle. Tendon, the fibrous, non-contractile and cord-like part of muscle. Aponeurosis, the flattened tendon. Raphe, a fibrous bands made up of interdigitating fibers of tendons or aponeurosis. Unlike a ligament, it is stretchable. And ligament are fibrous inelastic bands which connect two segments of a joint. You can see this is origin of a muscle, this is insertion of a muscle, this is muscular belly, this is aponeurosis, this is tendon. Tendon is non-contractile part, and aponeurosis the flattened tendon. Then we have some term used for describing vessels. Arteries which carry oxygenated blood away from the heart, with the exception of pulmonary and umbilical arteries, which carry deoxygenated blood. Veins which carry deoxygenated blood towards the heart, with the exception of pulmonary and umbilical veins, which carry oxygenated blood. Veins have valves and they allow unidirectional flow of blood. We have capillaries. They are microscopic vessels connecting arterioles to venules. Anastomosis is a precapillary and a postcapillary communication between the neighboring vessels. This is anastomosis. These are precapillary vessels and these are postcapillary vessels. Then we have some terms used for describing bone features. They are elevation. Elevation may be linear, may be sharp, may be rounded or irregular. Then we have depressions. Let's go to elevation first. It may be a line, a lip, a ridge, or a crease. The elevations may be spine, styloid process, corno, or humulus. There may be rounded elevation or irregular. They may be tubercle, tuberosity, epicondyle, malleus or trochanter, ramus, broader process projecting from the main part of the body of bone. Depression, which may be pit, impression, fovea, fossa, groove, or notch. Opening may be foramen, canal, hiatus, or aqueduct. Cavities, a large cavity within a bone, is called sinus, cell, or antrum. Smooth articular areas may be facet, condyle, head, capitulum, or trochlea. This is a bone. This is a styloid process, which is a sharp elevation. This is a foramen, and this is mastoid process, which is a little rounded elevation. This is another bone, the scapula and the humerus. We have tubercle, which is a small rounded elevation, and in the femur we have tuberosity, which is a larger elevation. Then we have a ridge. This is the line, sharp line. This is called supracondylar ridge. Then we have epicondyles and capitulum. Now we have sometimes we use mostly in our clinical practice or on basic sciences. Let's study them one by one. I have highlighted the main and important ones which are related to you, and you must learn this in your basics. Otherwise, you at the end of the year you will know all the terms. In you don't need to cram it, but some important terms which are highlighted, you need to learn that because the teacher may ask you that in your auspice. The itis means inflammation. For example, appendicitis, which is inflammation of appendix, tonsillitis, inflammation of tonsils, arthritis, inflammation of joints, etc. Then ectomy means removal of the organ from the body. For example, appendectomy, removal of appendix, tonsillectomy, removal of tonsils. Then otomy means to open and then close a hollow organ. Example, laparotomy, hysterotomy, and cystotomy. Then we have suffix ostomy, which means to open a hollow organ and leave it open. Example, colonostomy, tracheostomy. Then oma, which means a tumor. For example, lymphoma, osteoma, carcinoma. Then we have term puberty when a person develops secondary sex characters. For example, it is 12 to 15 years in girls and 13 to 16 years in boys. Symptoms are subjective complaints of a patient about his disease, and signs are objective findings of a doctor on the patient. Symptoms are the one that a patient describes. For example, when a patient comes to you and he says, "I have a headache, I have pain, I have fever," and signs are the one that doctor finds. For example, he has purpura, purplish dot on his skin. He has cyanosis. The lip color is blue. The eyes and the tip of the nose and the air lobules are blue. He has jaundice. The color of his eyes is yellowish. He has anemia. So that are Physical science. Diagnosis is identification of a disease and determining the nature of a disease. Then prognosis is the probable course and ultimate outcome of a disease. That how will the disease progress and what will be the final outcome? Is the person gonna live or is he going to die? Is he going to lose the major functions of his body? Is he going to survive? Is he going to be morbid? Then pyrexia means fever, lesion means injury or a circumscribed pathologic changes in the tissues. Inflammation. It is a reaction of tissue to an injury or abnormal stimulation caused by a physical, chemical or biological agent. For example, and how inflammation occurs. Firstly, there is swelling, then pain, then redness, then warmth, and then loss of function. Edema means swelling due to accumulation of fluid in the extracellular space. Thrombosis means coagulation of blood. Embolism. There is occlusion of a blood vessel, means blockage of a blood vessel by a detached thrombus in detached and a circulating thrombus. Hemorrhage is bleeding, which may be external or internal. Ulcer. It is a gap or erosion in the surface continuity of the skin or mucous membrane. Then sinus, it is a blind tract lined by epithelium. We have studied it in liver. Then fistula, a tract open at both ends and lined by epithelium. Uh, Fistula, you will study it in embryology maybe. Then necrosis, local death of a tissue or organ due to irreversible damage to the nucleus. Then degeneration, it is a retrogressive change causing deterioration in the structure and functional qualities. It is a reversible process but may end in necrosis. Then gangrene, it is a form of necrosis combined with putrefaction. Infarction, it is death of a tissue due to sudden obstruction of its artery and its supply. Atrophy, diminution in the size of cells, tissues or organs or parts due to loss of its nutrition. Dystrophy, it is diminution in the size due to defective nutrition. Okay, atrophy is diminution in the size of cells due to loss of its nutrition. Then hypertrophy is increased in the size without an increase in the number of cells. And hyperplasia, it is increase in size due to increase in number of cells. Then hypoplasia, it is incomplete development. Aplasia, it is failure of development. Syndrome, it is a group of diverse symptoms in science constituting together the picture of a disease. Paralysis is loss of motor movement of a part of body due to denervation, mean removal of nerve supply or primary disease of the muscles. Hemiplegia is paralysis of one half of body. Paraplegia is paralysis of both the lower limbs. Monoplegia is paralysis of one limb. Quadriplegia is paralysis of all the four limbs. Anesthesia is loss of touch sensibility. Analgesia is loss of pain sensibility. Thermanesthesia is loss of temperature sensibility. And hyperesthesia is abnormal increased insensibility to temperature. Then paresthesia, it is perverted feeling of sensations. And coma is deep unconsciousness tumor, a circumscribed, non-inflammatory abnormal growth arising from the body tissue. Benign, it is mild illness or growth which does not endanger life. Malignant, it is severe form of illness or growth which is resistant to treatment and ends in death. Carcinoma, malignant growth arising from the epithelium, ectoderm or endoderm. Sarcoma, it arises from connective tissue and it is also a malignant growth. Cancer, it is a general term used to indicate any malignant neoplasm which shows invasiveness and result in death of patient. Metastasis stasis, it is spread of a local disease and to the distal parts of the body. In convalescence, it is the recovery period between the end of a disease and restoration of complete health. Therapy, it is medical treatment. Now we have arrangement of structures in the body from within outward. मतलब inside to outside. Bones from the supporting framework of the body, then muscles, then we have blood vessels, nerves and lymphatics, then we have the thoracic and abdominal cavities which contain organs. And the whole body has three general coverings: skin, superficial fascia, and deep fascia. This is end of the chapter. Thank you very much. See you in next chapter. Please subscribe the channel and study with focus. Allah Hafiz.